Hello, I chose to do my Pathophysiology Module 7 assessment paper on Charcot Marie Tooth disease, or CMT. This is an inherited genetic neuromuscular disorder that affects the peripheral nervous system, and I should say most times inherited. I chose this disease as it's something I'm not very familiar with, but as a home health nurse I encountered a patient with this disease and I am interested in learning more about it. So this disease was named after the three physicians who discovered it in 1886, Dr. Jean Martin Charcot, Pierre Marie, and Howard Henry Tooth. There are several different types and subtypes of CMT, but all are caused by mutations in genes that support or produce proteins involved in the structure and function of either the peripheral nerve axon or the myelin sheath. So when this occurs, the nerve can no longer function and transmit signals due to the damage. So CMT type 1 is an abnormality in the myelin sheath. CMT type 2 is when the damage occurs in the peripheral nerve. Either of these can be from autosomal dominant or autosomal recessive inheritance. CMT type 1 is the most common form of all CMT and accounts for approximately 55% of all CMT cases. The only known predisposing factor of CMT is hereditary and gene mutation. CMT can affect anyone regardless of their age, race, gender, ethnicity. It can be inherited and passed on from generation to generation, or it can happen spontaneously due to gene mutation. The onset is very broad. It can happen from infancy all the way to adulthood, and patients with CMT may start to show signs of muscle weakness in their extremities, like feet and their ankles, but the onset is very slow, so it's very hard to pinpoint the exact onset. Some patients may notice an increase in falls or tripping, difficulty maybe like stumbling and picking up their feet. This is a slowly progressive disease, so it's going to continue to affect the nerves and the muscles with reduced reflexes, muscle weakness, wasting, neuropathy. Patients may have foot deformities, balance problems, again, those increase in falls, that reduce sensation and feeling, and muscle cramping. Testing for CMT includes genetic testing and also nerve biopsies, and this will help confirm CMT over other nerve disorders. There is no cure for CMT, so most of the times this is not a life-threatening disease, but patients with CMT are going to need physical therapy, occupational therapy. They may need assistive devices, leg braces, arm, wrist braces. They also may need some pharmacological interventions for nerve pain or cramps. There are no pharmacological interventions or treatment for CMT at this time. There are some ongoing studies, and they continue to research to try to find some interventions. So our patients with CMT, we should continue to monitor, assess, and educate patients on their high risk for falls due to their muscle weakness and wasting. Also that they're at a high risk for injury due to the loss of sensation, and that they may have open wounds that they're not aware of, so those, checking their feet, like our diabetic patients, as well as they may not be able to feel temperature or pain, so using caution. So yeah, that's what I have for Charcot Marie Tooth disease. I hope you found the information beneficial to you. I found it an interesting topic, and thank you for listening today.